Hi, my name is Deana, and I am a family nurse practitioner student for Walden University, and this is our Skin, Hair, and Nails Assessment 6511 Advanced Health Assessment and Diagnostic Reasoning class. And Gary is my husband, and he has given me permission to do this assessment on him. So what I'm going to do is I'm going to start off with color, and what I'm going to look at is the color of his skin, and he's a white Caucasian person, so the color is appropriate. He does have some darkening of his skin above his collar and darkening below the shoulder, which tells me that he wears t-shirts. Gary, do you spend a lot of time outside in the sun?
Yes, golfing and fishing.
Okay. And what is your profession?
I'm in law enforcement.
Okay. Do you wear any kind of sunscreen or anything when you're outside for long hours at a time?
Occasionally.
Okay. Do you have any kind of family history of skin cancer or anything like that?
No, I don't.
Okay. So this tells me that he spends a lot of time out in the sun, and he does wear short sleeve shirts that does allow sun exposure to his arms and his neck and upper body area. What I'm assessing here is appropriate at this time. The next thing I want to assess is the skin turgor, and what we're basically looking for is temperature and or lumps, bumps, and lesions. Right now I'm going to check for skin temperature. What I'm looking for is cold versus hot, and the difference between the two can mean hypothyroidism or hyperthyroidism. And right now his skin temperature is appropriate at this time. Are you cold or are you hot? Is
No.
the skin temperature okay? It's nice and warm, and it is appropriate for the temperature in this room at the time. The other thing that I will look for next would be for any kind of lesions, anything out of the norm for a person of his age. Gary is middle-aged. I do want to say 50 plus. So what I will be looking for are moles, hemangiomas, any kind of aging processes on his skin, thinning of the skin, anything that it would be appropriate for a person of his age. And what I am going to assess is just checking his skin for thickness or thinness, and everything here seems to be appropriate at this time. I do notice that there are some freckles, and I have looked at his hands, and I do notice there are what we call some age spots on his hands. They are not raised, they are not irregular, they do not have any borders, and they do not have any asymmetry. This is what we would be looking for anything that would be atypical for somebody who has skin lesions that we would refer to a specialist. The only thing that I do see here would be a mole on his chest. Now, Gary, how long have you had this mole?
For a long time.
Okay. Any changes lately, or anything irregular that you have noticed?
No.
Anything different?
No.
Okay. And I'm using my hand, or basically my pinky, to assess. I do not have a measuring tape to assess this, but I can tell you it's less than 6 millimeters. It's regular in shape. It does not have any irregular colors or borders, and so I'm going to consider this normal at this point. I do also notice a few little reddened areas, which I call hemangiomas or cherry hemangiomas. This is normal for a person of his age and stature. I'm going to have you turn around. I'm going to look at your back, and what I'm going to assess is freckles, raised bumps, anything that I feel that it's abnormal for the contour and symmetry of your body. Everything here feels normal. I don't feel any abnormal bumps or lumps. I'll have you turn around again. The only thing that I really do want to bring to attention is the fact that Gary does have tattoos. They are color in nature, and so what we have to do is check to make sure what we have to do is check to make sure that there are no abnormal discolorations, bumps or lumps along these tattoos. And I'm not feeling anything here. I'll have you turn to the side. And I'm not feeling anything here. Anything that would be raised, abnormal in contour would allow suspicion. I'm not seeing any kind of freckles or anything that really stand out in my mind. I know that he does, according to his tan skin, I know that he does spend a lot of time in the sun, but what I'm seeing here is normal. Gary, I do feel that your skin is a little roughened around the areas. Do you use lotion on a regular basis?
No, I don't.
Okay. This is telling me that this is normal for a person of his age and stature. A lot of men do not use lotion or emollients to keep their skin soft. And I do feel a little roughened areas over on this side here. I'll have to go ahead and turn around here too. And you can stand in front here. And I do notice a little roughened areas on his hands and his forearms. But everything here, I'm not seeing anything that is abnormal at this time other than just rough and dry skin. So what I'm going to move on to is the hair. And what I'm looking for, I don't know if you can sit down, Gary. I'll just have you sit down. And what I'm looking for here is even distribution. I'm looking for lumps or bumps and or hair loss or alopecia. And I do notice that the skin here is soft, and you have a nice full head of hair here. You do have a little thinning on the top, which is consistent with the male pattern baldness. I'm sorry, I can't talk. Male pattern baldness. Other than that, everything feels really good here. And then as far as distribution across the rest of the body, over the chest and the abdomen, I'm not seeing anything that is abnormal at this time. Have you had any problems with head trauma or lumps, bumps, lesions on your head that you know of?
No,
Okay. Hair growth does look good at this point, and I am not suspicious of any type of hair distribution. The next thing I would like to look at would be the fingernails, and I'll just go ahead and have you stand up here. I don't know if you can see this, but what I'm going to do is I'm going to palpate the fingers, and what I'm looking for is blanching, which would be the 3-second rule. So what I'm going to do is I'm going to pinch the skin, and I can tell you already that the skin is warm and dry, and blanching is less than 3 seconds. So that is telling me that the um, blood flow to the fingers is appropriate. I do notice some scratches on your hand. So Gary, can you tell me what's going on with the scratches on your hand?
German Shepherd puppy.
Okay. Have you had any problems with a fever or non-healing of the wounds because of this German Shepherd?
No.
Okay. All right. The other thing that I will be looking for is contour of the fingers. One of the things that we're looking at is ridges, bumps, discoloration of the fingernails. And I can tell you right now that all the fingernails are smooth. There's no ridges, there's no lumps or bumps. And then the other thing, I don't have a ruler with me at the time, but what I'm going to do is I'm going to have Gary put his thumbs together. Should put them together put them together as such. And can you see in between your fingers, which I can, which is telling me that the degree of depth or the degree of his fingers are appropriate. They're less than 180 degrees, which tells me that he does have appropriate blood flow. Anything less than over 180 degrees, I'm sorry, it would be consistent for any type of heart problems, which we would consider clubbing at this time. So the other thing that I would like to look at is Gary's legs. So Gary, can I have you put your leg up on the chair? And I don't know if you can actually see this or not, but what I'm looking for is redness, discoloration, or swelling of the lower legs. Gary, do you have any problems with pain when you walk, um, job duties, when you run, anything abnormal that bothers you on a regular basis, wakes you up in the middle of the night?
No.
Okay. I can tell you right now that there is no swelling, no edema of the lower legs. His toes are nice and warm, and pink, and they blanch just like the fingernails do within 3 seconds. Um, what I would also be looking for would be any kind of a venous insufficiency, which would be the brown discoloration. Also would be what we would call just veins sticking out. I would look for any kind of venous lumps or bumps, and I am not seeing that. The hair distribution over the lower legs is appropriate. If there was insufficient venous supply to the leg, we would possibly not see the hair distribution. But his legs are nice and pink. Their color is appropriate, and it's nice and warm, and there's good hair distribution. And there's no swelling. So that is telling me. Sorry. That is telling me that the blood flow. I'll have you put your other leg up. That the blood flow to the lower extremities is appropriate. Do you have any problems with pain? Anything like that? Um, Anything that wakes you up in the middle of the night?
No.
During the day? Anything that causes you to jump out of the chair, like cramps, spasms, anything like that?
No.
No? Okay. All right. So that is telling me that that is appropriate for this assessment. And what I would like to do is go ahead and approach the next assessment. I'll point this back out, which would be the, sorry, I have to move into the picture here. The next assessment would be the head, ears, nose, and throat. Thank you.